After months of bickering and debating in Congress, President Obama made history when he signed the new health care bill into law. But with all the new changes and information, understanding it may seem a bit overwhelming. So to help us make sense of it all and how it will affect our bottom line, we're joined by Amanda Gengler of Money Magazine. Amanda, great to see you again.
Great to be here, Tanya.
So a lot of huge changes are coming up, but we're just going to talk about some of the immediate ones taking effect in the next year, right? To break it down to digestible portions. And the first thing you say is that there will be some new risk for those of us who are new help for those of us who are high risk, right?
So by 2014, insurers will no longer be able to deny coverage or charge someone more if they have a pre-existing condition, something like a heart issue or even diabetes. But that's still 4 years from now. So the government has created a temporary high-risk program, and if you've been uninsured for at least 6 months, you can buy into this program and get insurance at rates that are more on par with what the general population pays, so they're going to be much more affordable.
Oh, that's a big relief to people who I'm sure are facing some chronic diseases and illnesses.
Yes.
Absolutely. All right. Next is that kids get a break.
Well, also starting this year, insurers are no longer going to be able to deny coverage for children with pre-existing conditions. So we're jumping on to that ban right away. We're not waiting like we are for adults. And maybe even a bigger deal is that young adults will now be able to stay on their parents' health insurance plan up to the age of 26 if they do not have benefits through a company. So if they don't have their own job. And today in so many states, kids are immediately kicked off the family plan once they graduate from high school or college. And one recent study showed that about 45% of young adults had been uninsured at some point over the past year, because we all know you don't sort of flow right into a full-time job with benefits right after graduation.
Right, that leaves a big group uninsured, and I know a lot of parents personally have told me that's a big savings for them, because they're the ones footing the bill and who are actually buying policies for their adult children.
Exactly.
So, all right. Now another one here is that many people can look forward to expanded coverage.
So right now, it's very common in individual and even some group plans for there to be lifetime limits on how much your insurer will pay out in benefits, maybe $1 million or $2 million over your lifetime, and that's going to be prohibited starting this year. And also, preventive care. Insurers want all of us to have screening tests regularly and get our yearly annual checkup. So all of those services, if you buy a new policy, either an individual or a group policy, are going to be free now. You're not going to face any co-payments or deductibles, again, because those are things they want you to do.
All policies will not
starting this year with new individual or group policies, as long as it's new. Yes, eventually it will be all policies, and also Medicare recipients starting this year as well.
All right, no more co-pays for preventive medicine. That's a big one. All right, now also you say that there will be relief from the donut hole. Explain that one.
So this is for Medicare beneficiaries that have Part D prescription drug coverage, and it's very common. And right now there's a gap in coverage. Once your total drug costs have gone beyond about $2,800
for the year,
have to pay for the year. You have to pay the full fare until your total drug costs hit about $6,400. So that's a big gap. It can cost seniors thousands of dollars, and there's lots of studies that show that they actually stop taking their medication once they get to that gap. So the goal is to generally phase that out, and in 2010, this year, anyone who falls into that donut hole will automatically get a $250 rebate, and then next year in 2011, once you're in that hole, you'll get 50% off on your brand name drugs, and then it'll gradually close by the year 2020.
That's big news for seniors, definitely.
Absolutely.
And now there's some new help for the uninsured as well. Is that?
There are all sorts of subsidies for people who can't afford coverage. So there's been a big expansion of Medicaid. If you make up to 133% of the federal poverty level, that's about $14,000 right now. Today for singles, you can get help.
Sorry, we've run out of time. Thank you so much, Amanda.
ABC News Now. Good to know.